Thanks for being available for the 90-day visit, Mike. I appreciate it, okay? We'll talk a little bit, kind of about your meds and how things are going, and then we'll get your blood pressure assessment. Most importantly, since we talked to you last, have you had any new stroke symptoms or signs?
I tell my friends that they saved my life. I really believe they did. If they hadn't provided the care they did in the direction at the time, we were having a picnic, a little barbecue, and got some burgers and some stuff on the grill, and gathered around, and I was sitting there with my RN cousin on one side and a physician's assistant PA on the other side of me, and suddenly they started looking at each other saying, something's wrong, and they would look at my wife across the circle from me, look back at me and say, something's wrong.
He had a stroke in Medford, and we connected via telemedicine. They're one of the sites that we have as part of a network of connected telemedicine hospitals that we cover. We were able to treat him, started TPA at the originating hospital, and then he was brought up here by air ambulance and went for a clot retrieval. He stayed here for a few days and improved very well, and then was able to return home. We enrolled him in the Step 2 study, and so then we've been able to transition then into an outpatient setting and continue to manage his risk factors, helping him with his blood pressure and his cholesterol, lifestyle modifications. And I know you've been sitting for a while, right? So I just want to make sure you haven't been up and around, because we're going to do your blood pressure check now, okay? All right, go ahead and put your cuff on. 124/69, is that right?
That's correct.
What was the pulse?
98.
Okay, thanks. A lot of the patients that come to us live at a distance and then go home. We oftentimes don't have an opportunity to follow them very closely. They don't have an opportunity for specialized stroke care after they go home. We're doing the same thing with those people at a distance that we're doing with the patients that come into clinic. We've worked with him locally where he lives to get labs and get an ultrasound follow-up to see how his arteries look, and so it's really kind of been a full circle in terms of his original treatment.
I think the biggest benefit of the telemedicine program is that it brings it to the people. It makes the care available to everyone. You don't have to quit your job, you don't have to drive for several hours or several hundred miles to get to that care.
You're taking the Lipitor or the atorvastatin 80 milligrams, right? Okay, all right. So like I mentioned, I think Dr. Lutzep and I talked before we called, and I think we're going to make some changes to that if you're okay with it. And tell me how you're doing for physical activity.
Well, I'm trying to amp it up as much as I can.
Okay, good. And I think that's one of the things we talked about in terms of a recommendation. It's one of the best things that we recommend for our patients is if you can get out and walk 30 minutes a day of brisk walking 5 days a week. And so then the last thing I wanted to talk about was, diet. The American Heart Association recommends a diet that's rich in fruits and vegetables, whole grains, high fiber, limiting your intake, lowering your intake of saturated fats. In choosing, if you do eat meat, choose lean meat, try to get cold water fish. So given that, tell me honestly, how many days a week do you think you follow that recommendation?
With the exception of the fish, probably 7 days a week.
So overall, I think it's going well except for the lipid, your cholesterol being a little bit higher than we'd like. So we're pretty much done. I'll get Dr. Lutzep and have her finish her portion of the exam as well, okay?
Are you on the aspirin alone now? You stopped the clopidogrel, correct?
Just aspirin.
Very good. And keep taking that once a day.
Right.
We also talked about your blood test with the cholesterol, and you're still running a little bit high. So we would like to switch you to that other medicine that's just a little bit stronger than the atorvastatin.
Okay.
And you are up for that switch?
Sure, no problem.
Okay, the main thing is that it can cost more. So you keep us posted, if you find that that's, you're getting too crazy a cost on that. Let me also do a quick exam here on you, okay? Hold your arms up in the air, like we've done in the past. Keep holding them there, close your eyes.
Okay.
And now keep your eyes closed and touch your nose with your right hand. You can open your eyes and take your right hand and do this for me. We'll be seeing you in a month.
Okay.
And then Darren will arrange to have that blood draw before we talk to you again.
Perfect.
Very good to see you.
I owe you guys a real debt. I feel like you've saved my life.